I would like to welcome back to the show Dr. O, and she has a background in integrative medicine and traditional medicine. And every time she's on, we learn something. Today, we're talking about a very interesting topic, and that is we all find information online in the medical industry, but some of it is in fact a myth. So I have a series of questions that we will ask Dr. O, and she will explain them to us. So Dr. O, welcome back to River City Live. And the first question I have for you is a very hot topic, and it has to do with probiotics. So the question is, do I need probiotics daily to be healthy?
Thank you so much for having me again, Mark, and it's so good to see you again. And probiotic is very commonly used supplement over the counter. And however, the research out there is excessive use of probiotics may not be right for our gut because it may change our flora in a direction that we may not need. And in integrative medicine, when we choose probiotics, we have a targeted approach. So we use a probiotic as specific for the condition or indication, such as we can use Saccharomyces and special probiotic for support our gut while we were on antibiotics for a short period of time. In terms of using, it's good for you, take these for a long period of time, we may not need it. So that's kind of a myth in public knowledge.
Now, something that's kind of related to this is yogurt. So consuming yogurt when you're on antibiotics, is that something that makes sense to do?
And the specific probiotic we use with antibiotics is actually kind of a yeast-based. It is not an biotic-based, so the decreased yeast infections, post-antibiotic urinary tract infections, and the symptoms of the lower abdominal and urogenital tract. It is not really a bacteria base, is a yeast base, which Saccharomyces, over-the-counter name for it is Florastor. It's also indicated to shorten the course of diarrhea, acute viral illnesses, or post-antibiotic diarrhea. So it's really, yogurt has hundreds, 1,000 organisms in it, and when you use a probiotic to support the gut to rebuild the organisms after antibiotic use is in the number of billions. So the average that we use, 11 to 22 billion, short period of time, 2 to 4 weeks maximum. But when we treat neurodevelopmental delays in kids with neuroinflammation, and then we use specific targeted probiotics. And as the yogurt is good for you, however, commercial yogurt has so much sugar in it, and you have to just read the label. If the one serving of a snack yogurt has more than 10 grams of carbs, it is too much of a sugar and actually defeats the purpose because it may promote more fungal and yeast growth in the gut.
Speaking of sugar, that's a perfect transition for my next question. Does sugar cause acne?
And that's a very good question. We get that a lot. And I mean, there is association with excess carbohydrates and a sugar in diet. May increase the fungal overgrowth in the gut, may cause dysbiosis, and many skin conditions may present themselves with the initial gut symptoms, which is excessive use of antibiotics or sugar or dysbiotic gut, which means dysbiosis means that we don't have a normal number of strains to support our immune system, yet we have very narrow number of variety of the bacteria in the gut. And I call them our, team players in the gut support immune system instead of gangsters. And but we need to use high fiber diet with a good balanced variety of fermented foods and pre and probiotics. Prebiotics is a lot of fermented foods and fiber, and then probiotics that the diet with high in good cultures. So then it may support our gut to support and the immune system. However, and if we are consuming a lot of sugar, it may also increase fungal overgrowth, and it may have some skin presentations.
Dr. O, we have time for one more question, and let's keep it on digestion. And my question for you is, do I have to avoid fat to prevent fatty liver?
Good fats is so important for skin and gut lining and the cellular membranes to be intact. So we've got 3 different kinds of fat to make our cells intact: omega-3, 6, and 9. And then studies are showing over the last 50 years more and more in the well-balanced good fat diet, but the less sugar to prevent fatty liver outcomes is the best approach. What is fatty liver is? Inflammation in the liver due to excessive sugar or usually high fructose corn syrup consumption in our diet, and alcohol and so many other associations may be turned into toxic compounds in the liver is more than the fat itself actually causing fatty liver. It's a sugar and the high fructose corn syrup, and then synthetic things in our diet, and also excessive consumption of alcohol is the bigger cause for fatty liver than the fat itself.
Well, Dr. O, thanks again for all your time and information. This is the perfect time to have this conversation because really we're talking about health and how it interacts with your body and digestion. And we're close to all of the holidays coming up where people typically eat a little bit worse or they consume more alcohol or whatever. So it's very, I guess, good to be aware of what's happening right now and what you're eating and to share this with your family. Now, if people want to learn more about you, where can they go?
They can go to our website, obtainhealth.com or Dr.Ozdemir.com. And they can also call our office at 904-287-7000.
Thanks again for all your time and information.
Thank you so much, Mark.